Hi guys, we're having a bit of a problem here at sailing vessel Reimagined. Well, actually one of our crew members. Robin's in really kind of not great shape right now, and I'll let her tell you her story, but she's having a lot of problem with back pain. She's been off work for about, at least a month? And we really just reaching out to you guys to give us some ideas on what we can do. Robin lives in Corning, New York, upstate New York, and we really need some advice. As you guys probably know, I'm from Canada, so I'm not really sure how to navigate the US healthcare system. But she's been in the hospital now 3 times with horrific back pain. Like, I'm sitting in her bedroom right now. She can barely get from her bedroom to the kitchen, but it takes 15 minutes. It's crazy. And she's been in the hospital 3 times. I'm gonna let her tell you her story, and maybe you guys can offer some advice. We really need your help. Robin's really in terrible pain most of the time. Sitting here in the bed, how would you describe your pain? Yeah, how would you describe your pain there, Robin?
Like a hot dagger in my back. I took a pain pill about 2 hours ago.
So what meds are you on now?
I'm on gabapentin for nerve pain. I'm on Ribaxin for muscle spasms. Mobic for the muscle tension. And when I got discharged from the hospital on Thursday, or the other day, they finally put me on oxycodone on a low dose for the pain, because the other 3, even as a combination, and I'm taking them around the clock, are sadly not working.
So I think, Robin, we need to take everybody back to where you started the story, and just go through the story in as much detail as you can, so people understand exactly what's been going on with you, and if anybody can offer any help, any advice, any way we can get negotiate the U.S. insurance system for healthcare to try and get Robin some help, I think that's where we need to go.
Or if you've been there, it's done that type of thing. Because 3 years ago, I had back surgery on my lower back L4, L5, and had the discs shaved down and the vertebrum shaved down. And I went in to the OR in excruciating pain like I have now. I came out and I had 0 pain other than the incision point. And I have had no pain for years. And a couple months ago, I started having a little discomfort, and it got worse, and it got worse. And in November, I went to see the neurosurgery office, explained to them what's going on, had an x-ray done, found out I have a herniation again. This time it's L5S1, so it's literally 1 vertebra down from my previous issue. And my insurance company denied the request for an MRI. But I ended up, unfortunately, going into hospital because I couldn't take the pain. My left leg was completely numb, and the inside of my right leg had also become numb. And I spent 8 days at the hospital for pain control, and I got an MRI done. After discharge from there, while I was in there, my neurosurgeon kept checking on me and recommended a epidural. So I had a spinal epidural of steroids into my back, and they were hoping that I'd get at least 50% relief. Unfortunately, I got less than maybe 10% relief with it. I did manage that this swelling decreased enough that I no longer had numbness in the right leg, and I was able to feel the left leg again. And I kept doing my follow-ups, and my neurosurgeon wanted me to have another specialized injection targeted to one specific nerve in my back. And I went to that appointment for the consultation because we got to do that first. And that doctor sent me out to the hospital again because my pain was absolutely horrific. And I spent 3 days in the hospital where they didn't do anything. Sent me home. Nothing changed. And I ended up going back to hospital again this past week. Spent 4 days in. And they didn't do anything.
Maybe you should mention that you were so bad that you felt like...
It's affected my mental health significantly. As you've probably seen, I'm a pretty happy-go-lucky, upbeat person. Normally. That's not just the camera, that's just me normally. And now I'm anything but upbeat. It's really affected my mental health. I've been bedridden for 3 days, or for almost 3 solid weeks. And I'm a nurse. I'm used to helping others. And now there's good days I can't take a shower because the pain is so bad and my leg is so numb. I can't trust myself to be in a shower for more than a minute or two, even with this. I have a seat in my shower, you know. I'm 46, I have a walker and shower seat and grab rails, and this is no quality of life. So I'm just, my neurosurgeon says I'm not surgical at this point unless I have another failed injection.
Maybe we should introduce you to Robin's
my little
friend.
lap dog. I rescued this beautiful baby. She's a 5-year-old Great Dane, double Merle. She's solid white. I rescued her 8 months ago, and it's killing me. I can't give her what she needs. I'm grateful I have 2 roommates that take care of her for me. But she hasn't left my side this entire couple of weeks. But so I have another appointment with that pain specialist for another consultation coming up in a few days to see what he recommends, because at my last appointment he said point blank the first injection didn't help. I don't see any point in trying again. It's delaying the inevitable. I really think you need surgery. That's not how it works here in the States. You gotta go through all these hoops and fail everything else before they'll even consider surgery. So I see him on the 17th, and then on the 18th I go back in and see neurosurgery, and hopefully I'll have all the notes from pain management with recommendations. But I don't know if I should go start getting second opinions, if I need to travel to New York City or someplace. I'm willing to do spinal fusion at this point, just to get quality of life back.
So guys, what we're asking is if anybody has any experience with particularly the U.S. medical system and the health insurance, because it seems like in order for Robin to get care, they need to tick every box and not take care of the patient. So if there's anybody out there that can help us, advise us on how to get through these hurdles, we want to get Robin back on her feet as quick as we can, and our goal is still to get the boat fixed. And sorry, I'm shaking the camera a little bit. It's very upsetting to watch Robin go through this. But if you guys can offer any advice, we really appreciate it. If there's any medical professionals out there that can offer any help for us, any advice, we're not really asking for money. We're just asking for some guidance on how to get through this, how to get Robin back on her feet, how to get her out of pain. She shouldn't be in this much pain. I mean, I'm sure if if she was in Canada, we wouldn't be having this discussion.
And my neurosurgeon said absolutely no physical therapy for at least a month. Because that's what I asked them. Because normally, you do physical therapy. I've been done physical therapy so many times.
So if you guys have any, once again, I'm probably repeating myself, but if you guys have any advice, any guidance, anything that would be helpful to us, we're just at the point we're just grabbing onto anything to kind of help us get through this and help us get back to working on the boat, because that's what we want to do. We want to finish the project and sail off. But
we got things to do and places to see.
Yeah, Robin right now can't even get from here to the kitchen without it taking 15 minutes to travel, what, 30 feet?
Yeah.
In absolute agony. So,
and I have to sit down because my leg goes numb in that process.
So to any fellow YouTubers or to anybody else out there that can offer some advice, please, we need that help. Thanks, guys. We really appreciate it. And we hope our next video is back to boat work. And Robin will be back to her usual cheerful, kind of funny self, because she's kind of the humor part of the duo. And, well, we have our other little friend here.
And your little buddy.
Who's actually asleep right now. But certainly Robin having the dog here is helpful to her, because she's pretty much attached to her most of the time. Like, the dog just seems to know what Robin's going through somehow. She seems to know. This is Ivy, by the way, guys.
Yeah.
So, any advice, please let us know. Comments in the comments below. You can contact us on our Facebook or on email. That's sv.reimagined. sv.reimagined@gmail.com. sv.reimagined@gmail.com. All right, thanks, guys. Once again, please, if you can offer any advice, thanks. Bye for now.
Bye. Ugh.